You told you are traveling all around India for surgeries.
Consultations.
Now you have reduced a little bit.
Yes.
So what is your experience, because you are traveling for many cities and meeting many places and seeing lot of clinics. So what is your experience in these things?
No, the surgical part I don't have any problem, and I'm like a non-complaining guy. Wherever I go, I don't complain that you don't have this, you don't have that. Whatever situation is given to me, I'll make the best use of it. Sometimes I'll go to a remote place where the suction doesn't work properly. Sometimes there is no power backup.
Yes.
Sometimes doctor does not have a particular handpiece what I wanted. So most of the time I carry my own instruments, I own my surgical kit, everything. But there are something which is not in my control, like a power backup. Sometimes, when we do full mouth rehabilitation, we are operating here and the washroom is in a second floor, third floor, or we are operating in a second floor, the washroom is in the ground floor. And when this, as you know, this procedure takes a lot of time, 4 or 5 hours. So some patient says in the middle of the procedure, they say, doctor, we want to use restroom. And the moment they get up, they'll have this syncope. So when you change your position, so naturally patient will have some syncope. So it is very difficult to send the patient downstairs or upstairs to go and use restroom and come. So all these challenges are there. In spite of that, these are all simple challenges, but the biggest challenge is most of them are calling me for surgeries. I do surgery and then go back to my place. But post-restorative is becoming a big challenge because most of these remote areas don't have a proper lab. Of course, you have that vision and started your own milling machines, but not everybody has this same vision. So they are dependent on their labs. So most of the places don't have a proper lab. So they cannot restore it in 12 days. Sometimes when I come back, in spite of telling them, repeatedly that, everything you communicate with me, each and every step, they don't, sometimes they don't follow it up properly. Sometimes the teeth are not fixed properly. So those kind of challenges are there.
You are conducting courses, right, sir?
Yes.
So you are meeting a lot of doctors who come for learning.
Yes.
So what kind of challenges you are seeing in teaching?
Teaching.
Because I know when somebody sleeps in your course, immediately
I'll make sure, because see, my courses are not free. Like, we charge them. Sometimes all these doctors are not anymore students now. They are all, most of them are good time practitioners. Most of them are practicing very well. So sometimes, when they come for my courses, just because they are not there for 2-3 days, they'll overwork there and they'll take a last flight so that they don't miss their clinic and then come for a course and sit early morning from 8 o'clock till 8 o'clock. So sometimes, when the ambience is good, they'll try to doze off. When I'm doing surgery, they are remaining active. And the important challenge is conducting a course. We usually take 10 doctors at a time, not more than 10 doctors. At a time, we take 10 doctors. So the biggest challenge is each doctor has a different surgical skills. So the biggest challenge for me is, like say, for you, I don't have to explain, you know everything. So you just wanted to see how I'm operating, so you just came over there. But not like you, there are many other doctors who don't know anything about implants. Some are reasonably good, sometimes some are in very advanced stages of implantology. So I have to carry all of them together. It's not that, I just teach only advanced, only for few people and leave rest of them. So few things, sometimes I'll go up to their level and start improving from there. So they get to understand each and everything. And one more thing is, all this has to happen in 2 days. All this has to happen in 2-3 days. 2-3 days I have to share all these things, and sometimes it will be too motivating. And one more biggest problem is, sometimes it will be too motivating, highly inspiring lectures and surgeries that they get highly motivated, and they instead of doing their own clinic, they'll go as, now they are going as a consultant and doing in other clinics. So that is a big problem again. So I tell them, you do in your practice, get that confidence, then you start doing in other clinics. But they get too much motivated, so that is a big problem.
So in your clinic, the full mouth practice, so in India, what is the challenges we are facing in day to day?
Day to day in the sense, in what aspect?
Patients, from the patient perspective.
right from beginning also, the biggest challenge what we are facing is uh, there's a problem with the education system. Education system means dentist means we have been sidelined. Medical, though we have studied in a medical college, so we have not been given that kind of training what the medical doctors get. So here the basic life support, how to manage emergencies, everything was, I'm not talking about now, I'm talking about 20, 30 years back. So that time proper education was not there. Now I think they have added few basic life sciences courses, emergency management, but that time it was not there. So my generation of dentists, those who are practicing now, they have no idea about if suddenly something happened to the patient, they are mute spectators. They don't know what to do, how to manage this patient. They just remain and see what is happening. Just like their patient relatives, the doctors are also seeing their face. So here what I did is, like when I had some problems in the small problems in the start of, luckily fortunately I never had any major problem, but whenever I had a small problem, then I used to investigate what should be done, what could have been done so that this patient problem could have been avoided. So we started adding oxygen cylinders, we started having emergency drugs in our refrigerator, and we taking all lot of precautions. Now we have a monitoring system, vitals monitoring system is there. We have a cautery, everything, all the equipment has. So every clinic should also have the basic necessary equipment to manage emergencies, especially because all these patients are old patients. You never know, because so much blood loss is also there. When you do full mouth rehabilitation, a lot of blood loss will be there. So you never know what will happen to any kind of patient. So you should be prepared for that. You should be prepared with equipment. You should be prepared mentally also. Because one or two clinics where I went, then the way I managed is, just recently I went to Mumbai. So I managed a patient who was like bleeding a lot. Full mouth surgery was done on the patient, zygomatic implant surgery. I don't know why that, but the patient bled a lot. So suddenly he went into a syncope.
Doctor or patient?
Patient. Patient went into a syncope, and this doctor panicking a lot. I mean, he was like, doctor, luckily you are there, so you are able to manage. Otherwise, I would have left this patient and ran away. Then I said, if you ran away, then who will manage this patient? Who will manage it? No, doctor, I cannot manage this patient. Patient is lying like a dead man. So it is essential and necessary that every dentist should have the minimum knowledge about how to manage the patient. At least if you are not completing the case, full mouth case, at least properly send the patient back home. Alive. Of course.
What is your next, any big plan in implant?
No, there is nothing big plan. Actually, as I love to meet a lot of people. Now I have come to Chennai with Dr. Murugavel. you. So I learned a lot of things from you also, like how you are managing your clinic, your staff. There is a nice ecosystem is here. There's a nice, beautiful environment is here, and how things are moving smoothly, without shouting, without all that noise. How things are going like a corporate world, and how you have incorporated so many equipments and everything. So I have learned few things, so I'll try to also incorporate in my practice. So whenever I go and meet some influential people, so I get to learn and change my life also. So I'll try to have these kind of things. When this doctor can have, why can't also I have? So I'll try to have this kind of things in my own practice. End of the day, it will benefit my own patients and me also. So if I have all the things to manage patients successfully, my health is also good. Otherwise, every day under this so much stress, I can't live well.
So you visited us. So any changes, any improvements, or any suggestions you want to give us when you are visiting? There may be some errors you might have observed.
No, frankly speaking, one of the best clinic I have ever visited. In fact, after I left the other day, I felt like why I couldn't meet this doctor a long back. So I wasted so many years not meeting you. So maybe if I had met you before, so many changes would have happened in Hyderabad, in my own clinic. So at least now, better late than never, somehow I met you, then I also to learn a lot of from you. not only you are managing patients very well, you are managing your staff, and one more thing I liked is you are taking care of your staff health also, because you are saying you are giving iron supplements, vitamin tablets. That is really commendable. I mean, it's great actually. Yeah, you're not just making them work, you are also taking care of their health also. That as that angle in you, like it really surprised me, and I liked it so much. Thank you so much. Because I get inspired by a lot of good people. See, so for this reason, there is a Telugu saying like, if you don't travel, you don't meet people, then you don't change.
Okay.
So only when you go out, meet people, then you learn also. Otherwise, you you are in a well.
Yes.
You are like a frog in a well, thinking that this is the entire world. But there is a lot bigger and different world outside that well. So unless you come out of that well, you don't learn anything else.
Okay.
So it is like this. So it is always traveling will help you a lot, where you meet a lot of new people, because it's never like we are the greatest ever. It is somewhere lot of people are there doing better work than us. So it is better we go and meet those people, get influenced, and say thank you also, sir. I learned so much from you. So it also give them that happiness that they shared so much knowledge with us. So sometimes some people won't share, but by looking at how the things are being run at their end, we learn a lot of things. Without them sharing also, we get to learn, okay, how he has managed, now he has so nicely arranged everything here. So maybe in my place, probably things are not arranged properly. So I'll say, in the clinic, see, everything is properly arranged. So much nice, beautiful photographs are there. So somewhere, we get inspired. So there is nothing like no end to it. It is probably, as long as we practice, we should keep evolving. The day if we think, no, there is nothing to learn, I am the greatest person, then it is gone. Your end is very soon now. So it is like always learning. And I have that, fortunately, like I always have that eagerness and hunger to learn. Many keep saying, you are now 51, you can just retire in under 5-6 years. Why you want to buy a new clinic, buy new equipments? Why you want to take all that stress? You have done good in your career. Why don't you relax and then slow down things? I don't want to slow down the things. I want to work aggressively as long as I want to work. I want to retire like a king, with no regrets, without any regrets. After retiring, no, I wish I could do that like Murugavel. I wish I could do like that him. I wish I could do like that him. Doesn't make sense. So when things are in my hand, I can possibly make changes and get that. And now my daughter is also studying dentistry. So it will be a good platform for her also. So for the younger generation also, next generation. Also, like your daughter is also studying, want to pursue dentistry. So it is a beautiful platform actually. I would say it is like everything is served on a platter. So instead of settling it like, okay, my papa has given me all, now I'll relax nicely. What I recommend her, or I keep telling my daughter, that okay, now you have brought from here to here. Now it is her role to it is like taking the baton and running like this. So what all the small things, what all the difficulties you had faced, probably she will not be able to go through all those things. But she has got a good pole position, like in F1 car race, we call it as a pole position. Pole position. Now she has got that pole position, so that is got unfair advantage. I would say she has got the unfair advantage. Now compare when she joins Ramchandra, she will be the most privileged when compared to all her classmates. So that means she is already she is at a higher level when compared to other classmates. So from there she can easily carry to the next level. So she should think of something bigger than what you have achieved. So that is that gives pleasure to her. It's not that always you should be self-reliant, rather than my father has earned so much, now I'll live my life with that. Means somewhere some part of your life, in her life, she will not feel good. Maybe I should have done something different on my own. I wish I could do something on my own then that gives more satisfaction than what she acquires. And you know, whatever you have done, it is for herself. But what she gets, what she acquires through her own effort will give more satisfaction than what you give her. So that is there. See, because she is there, so I'm also telling. Even I keep telling my children, so do something good, be self-reliant, don't depend on me. Of course, I'm there, but don't depend on anyone.
Doctors who are shifting from single and partial implant into full mouth practice, they're doing single and partial for a long time, but they are entering into the full mouth. So what advice you can give? See,
everybody should take a calculative risk. What I feel, many are not like there is a saying, no risk, no story. So, I mean, you have not taken a risk, that means there is no story of yours. You are like a 1 in 1 billion population. You are like 1 in 1 billion. Nobody is talking about you. That means you have not done anything good for yourself. So, when we have come here, that means we should make some impact in our field and then retire. So, like at least for a few generations should talk about what so-and-so gentleman has done in this field. So, I want to make some impact before I take retirement. So, lot of doctors, what they do, they are in a comfort zone. The biggest problem with this MDS is also, like if they are in a perio, the whole life they will be doing flap surgeries, laser, flap surgeries. If somebody is told like, no, that fellow is doing implants, it has got a good practice, it gives you good money also, but they don't want to go there, in spite of being a very good fortune is there. But why? Because they don't want to move from their comfort zone, because this 3 years is mind is adapted to doing all the flap surgeries. He is doing comfortably, he is doing good enough with flap surgeries, he is making good amount, decent money, but he doesn't want to move to a different field because he is going out of a comfort zone. So the moment you go out of your comfort zone, only then lot of things, the change should always be there. If there is no change, then your life will become boring, definitely. And at the same time, you are making a big impact on patient's life also. See, I have done now I have taken so many risks in my life, and I have done some crazy surgeries. Obviously, okay, I made name for myself, but I helped so many patients also. Those who have been said no bone, impossible to treat, but I have restored and then given them the new life, new transformation I have done. So, and that gives me more satisfaction. Of course, money I'll get, but patient says, sir, aapko dua mil gaya, dua denge. So patients are very happy about it. Yes.
And one thing I observed is the doctors who attended your course, they are doing a lot of surgeries, and their work is also very good and decent. But this is only possible by a good teacher and a good teaching method. Somewhere down the line you are doing it in a correct way, and you should not stop this. You should do it in a much frequently and more bigger way, so that more doctors get training and do some good work to our patients.
True.
Yes.
Not only we train the doctors, post training also we keep correcting on WhatsApp. If they are doing any mistakes, I'll tell them. Sometimes instead of group, I'll message them personally saying you have done this wrong, because I don't want to tell everything in the group and make him feel bad. I message him, doctor, if you can slightly change your angulation like this, and if you could go slightly further up, then you can engage the cortical bone. Then he realizes his mistake and then say, thank you doctor so much, thank you so much. And I don't want them to acknowledge in the group also that, but I don't want to be praised in a group. I love to be, in fact, sometimes I feel like I'll just follow you. So, very nice.
Thank you very much for
thank you.
sharing your knowledge.
Sure.
Anything else you want to
share? Coming here itself is a big privilege for me. You made my day. So, honestly, I'm speaking, not because of this podcast, whether you will upload this or not, in front of your own daughter, I'm saying. In fact, I am inspired by you in so many ways, not now, long before. Sometimes.
Goa
also, when I just came out, normally every day I go for a walk. At least if I walk for 6 kilometers, I'm very happy. Even if I don't operate also, it's okay. But if I'm not walking, if I just don't go out and walk, and then daily, every day 6 kilometers I have to walk.
Fantastic.
So that day morning I came out of my room. I could have slept well, but I came out of it. That day, if you remember, it was raining. It was slightly raining. Many people would have said, nice weather, nicely sleep. But I just went out for walking. Then I suddenly saw you. This fellow looks like a Murugavel, because I have never seen you personally. Some YouTube videos, some award function photographs. I have seen Dr. Murugavel receiving some award, so and so award. This thin looking guy looks like Murugavel only. So I just walked for a while. Then I greeted you like, hello sir, Murugavel means, yes, Murugavel. Then we walked for almost half an hour, 45 minutes. So that was the first time when we met in Goa. Yes. That was like nice, very nice. So it is like, for her also, for a message for her only. It is all about, the life is all about, the bottom line is, it is all about whom you meet at what point of your life is very important. And there is also saying that try to be, you are an average byproduct of 5 people whom you meet regularly. Simple.
Yes.
That defines you what you will be in another 5 years. Now she goes and joins in Ramchandra with all that 5 useless fellows. Example I'm saying. Then she is the average byproduct of all that useless fellows. If she is sitting with a very nice vision, forward thinking, positive people who want to do good in their life, want to study well, do well, daily she will sit with 5 good people. She will be the natural, even if she doesn't want to be she'll be the average byproduct of the 5 people. That's all. That means 5 divided by 1, that means mathematically she will be the average byproduct of 5 people whom you meet regularly. That is not only for student, even for us at this life age also, it matters. Whom you meet is very important. So you have to choose whom you have to meet. So sometimes you meet people, useless people. So it is better, stay away from them. So you think this person is going to help in some way, try to hang around with them. So somewhere, even if you don't want to share also, I learn what he is doing. Somewhere everything is there on public domain now. So we can learn from this. Suppose if you have not invited me also, I would have known, okay, this guy has got the milling machines, big staff, management, everything I would have known. But meeting is a privilege. Yes. So like same way I told, I met my professor. He told me they go for implantology. Then he sent me there. Understood? If I had not met him, probably I would not have gone there, or maybe I would have gone somewhere else at a later date, not that particular point of time. So meeting right people at right time is very important. Yeah. So if you have positive mindset and if you have willingness to do something good in your life, then naturally all these things will happen. These opportunities are there everywhere. We just have to find them. Opportunities are there everywhere. We just have to find them. That's all.
Thank you. Thank you for
welcome. No problem.
Experience and knowledge.
No problem.
Because when I heard your
sit down, kuchu. No, don't want to sit.
When I heard your story during the course, I was very much inspired from the beginning, family, from the PG, how you entered the PG, started a small. Yesterday you were sharing the first practice was only this much.
Very small, sir. Very small. This much practice.
It was amazing growth. Many doctors.
So the biggest challenge was, sir, I told the Hyderabad culture is a lot different from this Chennai and thing. Of course, it is our mindset, but I don't blame the cities. When you are, see, all things have come all at a time. See, I passed out. We didn't have much money. I got married. Then within 1 year, one girl has come into my life. another 2 years, one more girl has come into my life. So I had so many responsibilities of, having a good home for them, children, good education for them, good life for them. At the same time, I have to pick up my practice, improve my practice. We should have a good house, good clinic. Then we should do good in our career. And there is no scope for learning that time. You want to learn, but there is no one willing to teach you. Now, these days, it's easy to learn. Now, the younger generation are doing, within 6 months, 1 year, they started doing zygomatic implants. But that time, it was not there. It was very difficult. That time, it was very difficult. So, arranging all things. At the same time, you need to have some financial stability in your life. So, you have to acquire some properties. At the same time, you need to improve your practice. They said wife requirements are there, that children requirements are there, they said patient requirements are there, and you have to take care of your own needs. So all of these things have come all at a time. So if this generation, when they have that money, and like it is saying, money will solve 95% of the problems.
Okay.
Money will solve 95% of the problems. Is there a saying? It is there. Obviously, 100% true. You have money, then in your 95% all problems are solved. Only thing is you have to take care of only the 5%. But whereas where I started, all have come at a time. So I have to take care of each people who are dependent on me. So that was a big challenge. And at the same time, you have to grow professionally. So it is like it is not a easy job. Sometimes I feel, why did I take so much time to get here? But then if I look back, then each year what I did, so sometimes, it is better to have a slow standard growth rather than going one shot up and then coming down. So it is like this. So it is better to have, but it took almost 28 years now to reach here. Okay. And I'm happy, even in ChatGPT, you can add this also. Okay. You open your ChatGPT, I want the best implant surgeon. Then it will recommend my name. Okay. DR.K.A.Reddy is one of the leading zygomatic implant surgeons in India. Okay. It will say. So recently my daughter sent me one screenshot. Okay. I want zygomatic implants. Where can I get it done? Means it said, since you are based in Chennai, you can try one or two doctors here. But if you are willing to travel to Hyderabad, try DR.K.A.Reddy is one of the leading implant surgeons. So it has suggested her to go to Hyderabad to get the zygomatic implant. So most importantly, being an endodontist made a big mark in zygomatic implant. That is a really big achievement for me. Yes. And happy doing it, but I still don't want to settle down here. If anything, new scope, new challenge, new technique, which is there, I really want to do it. That's all. It is never an end to it.
Thank you, sir. Thank you for sharing.
No problem. Most welcome.
Anything else, sir?
No, nothing. All good, sir. Thanks.